It is just a huge honor today to be sitting in my house with Dr. Gregory Tuttle. Thank you so much for coming by. He has over 1,000 posts on Dental Town. I'm sure you already know who he is, but his website is TuttleNumbNow.com. Tuttle is name. Now, are you Delia Tuttle's husband?
No. I know she's popular on Dental
How come
Town.
you're not wearing pink? I'm confused.
Well,
I'm confused talking to a Tuttle who's not in pink. Delia Tuttle was, I think she lectured here last Saturday.
She's great, Townie. Everybody loves her.
She is amazing. So TuttleNumbNow.com. I think. Let me read your bio. TuttleNumbNow is founded by Dr. Gregory K. Tuttle, a general dentist who practices in Sacramento, California, and Orem, Utah. Since graduating from the University of Medical College in Nebraska in Lincoln in 1990, Dr. Tuttle has valued high efficiency and quality for more than 25 years. In 2003, Dr. Tuttle encountered a tough-to-numb tooth, and X-tips were on backorder, so Dr. Tuttle figured a way to penetrate the mandibular buccal plate without drills, ports, or sleeves, using just a 30-gauge needle. His discovery led to a complete change in the way he approached local anesthetic, and patients raved about not having a numb lip or tongue. Now, after 13 years of clinical success, Dr. Tuttle has revealed his findings in TuttleNumbNow.com. This protocol dispels myth about bending needles, penetrating the buccal plate, the use of Articaine in the mandible, and epinephrine in intra-osseous delivery. I think what you're doing, I've been a big fan of your 1,000 posts, but in a nutshell, I want to back up before you. When I got out of school 30 years ago, when I did a crown, I billed Delta of Arizona for $1,000, and they paid half. 30 years later, they pay $600. And the bottom line at the end of the day, if you take a PPO that's 40% less, you got to go 40% faster. And these guys and gals, I know what they do. I mean, I've been a dentist for years. They numb up, they get up, they take off their gloves, they go back to their office and get on Facebook for 10 or 15 minutes. And they don't have 10 or 15 minutes because, I mean, the faster you can numb and get going, the shorter the appointment. And if you went from $1,000 crown 30 years ago to now doing one for $650 on a PPO, you can't schedule an hour and a half for that. And that's why general dentists can't do ortho, because the orthodontist is flipping those chairs every 15 minutes. And then you start doing ortho and you schedule those appointments in a half hour. Well, if the orthodontist had 50% overhead at 15 minutes and you're scheduling a half hour, you're doing it for free. Do you think, before you talk about your technique, do you think it makes you go faster so you could be more profitable?
Yes.
I do.
Yes. One of the slogans is set down the syringe and pick up the drill. So if you can set down the syringe and pick up the drill with instant numbness, then you eliminate all the guesswork and the waiting, because the average dentist, my son was graduating in 2015, and I said he can't do this jab and squirt, numb and wait technique. He's got to get in there. He's going to be $500,000 in debt. He can't just do jab and squirt, and so he needs to have protocol that eliminates the guesswork, because when you do the first shot and you go to drill and they jump, the dentist doesn't know what to do. Do I wait longer? Do I give them more anesthetic? Do I use a different kind of anesthetic, Howard? Do I do a PDL injection? Toothy, jamming in the PDL, which there's a space which causes post-op sensitivity, tooth distension. Do I refer him? Do I make another appointment? Do I sedate him? Do I say, hey, just hang in there, buddy? This is a live like you were dying, Tim McGraw. You get the 2.7 seconds on Fu Manchu here. Just hang on. We're going to do this. And they don't know what to do. And so I said, he's graduating. I didn't make some videos that I discovered. I discovered this technique on how to begin with intra-osseous instead of using it as a secondary injection. The X-tips were on backorder. I had a tooth that I could not get numb. I'm sweating, the patient's sweating. We've all been there. And I tried to just ram jam. I knew where it needed to go, but I didn't have an X-tip. The needle bent, and I tried to get it in, and then all of a sudden it went in. That was the Eureka Moment. I was like, I got him instantly numb with minimal anesthetic, a fourth of a cartridge. I set down the syringe and went. The patient was relieved, I was relieved, and we got it done. So from that moment on, in around 2003, 2005, I started to eliminate the IA block. Instead of only using the X-tip once a month or once every 3 months.
You keep saying X-tip, but a lot of people won't know what that means.
Yes, because 55% of those that become TNN dentists, they
become what?
The TNN certified dentists. We can talk about that. Yeah.
TuttleNumbNow.
Okay. 50% of them have never done an intra-osseous injection, and their choices usually are Stabident and X-tip, all of which you have to drill a hole in the bone.
Ryan, can you send me those X-tip, Stabident? Explain what those are first, just in case they're driving to work and they don't know what either of those are.
Okay, so you can go on their website and figure it out, but basically you're drilling a hole in the bone. It's a secondary anesthesia. It's not considered a primary anesthesia, according to the American Association of Endodontists, because they said that because of the cost of armamentarium, an X-tip is about $5 per port. Stabident is about $2.50 last I checked. The cost of the armamentarium, the risk of penetrator separation, the temporary tachycardia, making the heart rate elevate, and the risk of root damage on drilling into the bone, the risk of root damage, that it should not be considered as a primary injection technique. That's American Association of Endodontists. 50% of the general dentists don't know how to do intraosseous, and then those that do, 90% of them only do it once a month. We took a survey of those that have joined the TNN certified team, basically, and 50% of them use intraosseous daily. We did some market research, and so 50% of them are using intraosseous daily. Some are still using it only on tough-to-numb teeth, but the main advantage is to the patient. No numb lip, no numb tongue. You're the college student. You're coming in. You can only be seen this certain day or whatever, and then go back to school. We can work in all four quadrants.
Okay. You talked about X-tip and Stabident. The other two would be the PDL and the wand. Talk about those two.
Okay. In my information on my website, I compare the difference between those. But the wand, everyone can learn a lot from the wand. It's on its delivery, on its pain-free delivery. The American Association of Endodontists, in their study, they studied these. They're called C-clads, computer, aided delivery and local anesthetic delivery. Computer, local anesthetic delivery, C-clad. And they found that they were 37% effective, maybe 21 out of 74 irreversible bulbitis teeth or super hot tooth was remedied by the C-clad. So therefore they said that C-clad wasn't adequate on a super hot tooth. And the very best for a super hot tooth was intraosseous injection, either with Stabident or X-tip, and using Septicaine and Carbocaine if needed.
Okay. A lot of so why don't you explain? You brought TuttleNumbNow. Why don't you explain what that is? Because I'm sure they know what a PDL is. You know what the bizarrest research I've read on a PDL is?
What?
That it didn't matter what anesthetic you had, even if it was distilled water. That if you put in a carpule, it's pressure.
Yeah, it's pressure.
You're putting pressure in the PDL, which contracts the nerve, and it stops working because of pressure. Did you ever see that study?
Yeah. So
you believe that study?
You're trying to force liquid into a space that doesn't exist. Especially some like to do it in the buccal furcation, but once the buccal furcation is compromised, we know that that's not good for a tooth. So we stay outside of that zone of the PDL unless we're extracting a tooth. But there are a lot of handbooks on dental anesthesia, but there's not a cookbook. This is a cookbook. The main thing is for hard to numb teeth, and so dentists know exactly what to do. If I can write in my chart TNN 4, I know that I went through the protocol. I did TNN 1, 2, 3, and 4. so they know exactly what to do and when to do it without waiting.
So are you gonna? Will you show us what TNN 1, 2, 3, 4 is now, or did you want to go through the protocol, or what? How did you want to explain this to them?
Well, I know that Dentaltown is to help dentists, and it's not to sell products. And so I have to be careful. I haven't even started a thread on Dentaltown, even though I have 1,000 posts, but I've tried to defend what people would say about it, and also offer suggestions.
Well, first of all, on Dentaltown, here's the rules on Dentaltown. So let's say you lecture every weekend on something. Everybody's allowed to start one thread on what they do, sell, lecture, consult, and all that stuff. So everybody gets their one thread.
Yeah.
And on the other threads, you just have to answer like you would be sitting at Starbucks. But in your signature, you could have your name, logo, and all
I do
that
have a
stuff.
signature.
But I don't buy into the selling is a 4-letter word. When I started Dentaltown, I owned Dentisttown. And I went with Dentaltown because if you took away all these amazing companies, I'd be sitting out on a rug with a bunch of stuff from Home Depot. And I've been to many countries where that's how they do dentistry. And if it wasn't these amazing companies making digital x-rays and intraoral cameras and hell, I even use my iPhone. I mean, if I took away all these companies, I'm not a hot doctor. I'm a horrible doctor.
Right.
And I think, and I want to say one thing about the injection, that, all the people are trying to sell you, the big companies they want to sell you $100,000 CBCT when the greatest implantologists of all time did all their implants with a pano. But you have to have $100,000 CBCT. Same thing with chairside milling. The greatest dentists I know all use an amazing lab guy.
Right.
I don't know any amazing dentist who chairside mill their crown. They didn't go to dental school to be a lab tech.
Yeah, I'm with you.
But I'll tell you this: after 30 years of practicing dentistry, I get asked for a same-day crown like once a decade, and then I call my lab man and say, "Hey, this guy's going out of town tomorrow. Is there any way we can get it back ASP?" And they say, "Yeah, you don't abuse it." Yeah, but I tell people that half of America is afraid of the shot.
Yeah.
And half of America is afraid of the bill. So get down.
That's
I mean,
good.
I
That's
want you
why
to
I'm
have
here.
a chairside manner that's not condescending, doesn't make you feel bad. And fear is completely irrational because my biggest babies have tattoos all over their arm, 1,000 shots from an unsterile needle, and they have a bar through their tongue and a paper clip in their eyebrow. And I'm like, what are you, I want to say, what are you afraid of? That this will be your first shot that's sterile? But it's just in your mind, just like a scary movie. The whole family went and saw it.
Yeah.
Obviously, it's a silly, goofy movie, but if you get into it, you're scared. They're just as scared of the shot. And I think the best word of mouth referral is when once a day a patient says, "Dang, you're good at that, doc. You didn't hurt me. That's what I was afraid of."
Yeah. Let me show
And
you.
then as far as afraid of the bill, here's the number one clinch you got to. There's only 3 publicly traded dental companies in the world. 2 in Australia, 1 300 Smiles. The other one is what is it, Ryan? Pacific Dental Smiles.
Yeah,
Is it
Pacific Smiles Group.
Pacific Smiles Group, 1 300 Smiles, and Q&M out of Singapore. You know what all 3 of those have in common on their websites?
What's that?
They tell everybody, I don't care what you need, we can do it for $99 a week. And if I said $400 a week, I mean, a lot of Americans, $400 a month, that's a big bill.
Yeah.
But psychologically, you say, don't worry about the bill, whether it's care credit, financing, stage treatment, don't worry about it. We'll fix anything you got for $99 a week. And that's the fear of the cost. And I brought you in here today because I'm a big fan of yours. And I think if these guys come out of Midwestern with $500,000 student loans, if they have an awesome chairside manner and an awesome pain-free shot and can figure out a way to finance, what percent of Americans go pay $30,000 for a new car versus finance it for 5 years? So figure out your financing. So I want you to tell them
So let me just show
what
you
you're doing. Yeah, just show them.
Let me show you
And
what
sell.
you
I want you to sell it.
Okay.
I want the goal of this podcast that 100 homies get it. Every once in a while, something comes along that turns a professional field and completely transforms the industry.
We're transforming the industry. I sat with a major manufacturer right here, and he said, one of the consultants came in and said, "What are you trying to do?" And I said, "I'm trying to change the world." And so here's what we're doing. I got a cover sheet on how to get a successful start. That's how to get right off to a successful start when doing TuttleNumbNow. When they order online, anytime, night or day, they can go to TuttleNumbNow.com and order online, download all that's here. The notes. I follow it up two to 5 days later with a thumb drive, which has 4 videos. The longest one is 14 minutes long. It will show you exactly, step by step, how to penetrate the buccal plate with a 30 gauge needle.
Now, is that a video?
With no drilling. There's 4 videos on here.
Why don't you start a thread and put those 4 videos in there?
Yeah, because we're going to, but we have to do this the right way. I started in 2005. I thought all I need to do is write in a journal and tell about it and tell my friends, and they're all going to want to do it. Immediate numbness, all 4 quadrants, patients love it, no numb lip or no numb tongue. I'm numbing people that have never been able to get numb before. I thought everyone would like that. I got no responses, not 1 email. I didn't change a thing. So I said, if I'm going to make change, I need to go to these authoritative figures, these dental icons. I need to go straight to their office, and I need to show it, and I need to do this for them. And that's exactly what I did. I started in 2015. I made videos for my son who was in college to teach him. I got an idea to go to the dean. Hey, what do you think about this? He said, that's awesome for the handicapped and the disabled. You're getting in. They don't even have to open their mouth. There's so many advantages. I can do a crown on 30 and 19 on the same appointment on a Down syndrome kid with a big tongue and cheek. I'm not even doing a block. I'm just numb, you're numb and done on one side. Hey, how'd you do? Good. You want to do another one? Let's do another one. So we have I discovered a needle in 2011, an osteocentral needle, it was called, in France. And that needle is a double beveled scalpel tip. It's 29% less force to penetrate.
It's from France. France is Septicaine?
Septicaine.
So Septidon makes that needle?
Septidon. And
their American division is in French Quebec, Canada.
Mm-hmm.
Right?
So
Montreal.
I went and I told them about it. And I said, this needle goes into bone. And they said, you know what? You're not authorized to use it in bone. It's only for infiltration. In fact, we don't even make it in a long because we don't want you doing blocks with it. Because it's a lance, it cuts stuff. And so they said, you really shouldn't be touching the needle. So what I had to come up with was a way to do my technique, which would satisfy the rest of the world that are a little hesitant with touching a needle. So you get this needle that was designed to go into bone, then this patented hub. It's a needle guide, and that goes right in like that, and it goes right like that. Retract, and then go. You can't go right in. I've had people watch me do the procedure, and then they go try it, and they can't get in bone. And I was like, and someone said, you just need 4 steps to the technique. And I said, well, water skiing. I have 20 steps to the technique. And I take a very detailed explanation, just like dance moves. Once you get them down, you've got it, and you're rolling with it. But
you must be a dancer to say that.
My wife is.
What does she dance?
She danced. She was on a dance team, drill team, and Cougarettes at BYU.
Cougarettes.
Yeah.
Okay.
Yeah, precision dance team. So anyways, we came up with that, and then they said, well, what about recapping? And I said, well, what about recapping the bent needle? It's safer than any other. You're not doing a scoop technique. You're not using you're going right over, and the tip is away from the force. Bam. So the recap's there. Now, what about bending the needle? Stanley Malamed said, I've always been opposed bending the needle, but I saw your video, and it's very compelling. And I was like, wow, awesome. He's watching my video. So take a look. I bend it over, and I bend it back, and it's done. It breaks off. That's why you never use that 30 gauge needle. on a block, and you don't bury it to the hub.
Now, go back to the beginning. What is different about this Septodont made in France needle?
It has a double bevel scalpel tip. It has 29% less force to penetrate. So if I'm doing an infiltration with it,
Say that again. So it has 20. Say it again.
It has a double bevel right here. It's in the booklet. It has almost a hatchet cut to it, and it will penetrate the buccal plate easier than other needles. But you still need the steps, you still need the training so that you don't cause problems.
So that's the use of the 30 gauge Septojet Evolution needle.
Yeah.
So is that the needle you recommend for all infiltrations?
Yep. Yeah, totally changed.
Because this technique's only for the mandible.
No, you can do it on every tooth. For example, Monday I did 8 and 9 crowns. Instead of doing an injection here, topical and injection, topical and injection, topical and injection there, all 3 hurt, even with topical sometimes. You gotta go easy. 1 injection, the way I train, 5 millimeter penetration right through the front, low pressure, low volume, overtime technique is what it discusses. Similar to, the wand will give you a 4-minute distribution. I'm about a 90-second. So 90-second distribution, an infusion, not so much an injection. Okay? I like a really nice syringe. This is also made by Septodont, but where you can have precision, where the plunger glides smoothly instead of skipping, and it also can deliver a drop at a time like you need to. Okay, so with that 1 injection, complete and profound pulpal anesthesia on the 8 and 9, and no numb lip for your cosmetic pictures, your follow-up. So if I'm pushing fluid through that needle, I showed you that I bent it over and bent it back and it broke. How many times do you think I can bend that over and bend it back with the needle guide on there?
You can bend it straight up and
right here at a 90. Kink it at a 90. Kink it straight up. Squirt.
Yeah.
Kink it and squirt. How many times?
5.
Okay, I just did 4. I just did 1, 2, 3. Okay, squirt. Do you want to do it, or I could do it?
No,
4, 5. You're getting your table messy. 6. Nice home, by the way. 7, 8. Really kink it. 9, 10, 11. 12, 13, okay, you get the point, right?
Yeah.
15, 16, 17, I've gone up to 100. That's 18 right there. That was some serious kinks, So, my point that I had to prove was you can bend a needle safely. Now, with that bend, you got greater versatility, range of motion, you got root proximity problems, you can get right in, and you're not drilling. So now, all of a sudden, I'm staying away from the PDL. I'm penetrating the buccal plate. I am delivering anesthetic almost 8 millimeters all the way to the lingual plate. And with 1 injection, sometimes 2, everything blanches. And I'm getting that infusion, and I can go right in and pulp that tooth. I can extract that tooth. I can do my...
So when you go in from the buccal, the lingual is blanching?
Because that needle is advancing 8 millimeters. I'm penetrating the buccal bone. That's the secret of it.
So your Eureka Moment was that when you just happened to be using a Septodont Septoject Evolution needle.
No,
you realized it went through the bone.
No, those didn't come out until 2011. My Eureka Moment was in 2005. I looked at the order of my X-tips, and that's the last time I ordered an X-tip, because now I could get in with my technique. It's counterintuitive.
What was your Eureka Moment?
My Eureka Moment.
You were out of X-tips.
I was out of X-tips.
They were on back order.
I went to I knew where it had to go, and I knew how to get there, and it went in without drilling. And then I had a good self-seal around the gingiva instead of wondering how much is getting in there. You got the X-hip, you got the port, and it limits how deep that needle can go. And so I could advance it. I had versatility, range of motion. I got it in there, and I just immediately, the patient was comfortable. And I said, I'm doing this every time. And so I tried all these different needles, all different variations, different locations. And over 14 years, I've figured out how to do this on every tooth.
And so what percent has this replaced your inferior alveolar nerve blocks?
Okay, inferior alveolar nerve block is and I use Gow Gates, by the way, that's my 7th injection if I have to get to it. See, there's not one injection that's going to be universal. I mean, the new guys, the young guys, they want that. And it does a lot of times. The lower first molar is my easiest tooth to numb.
But it's their hardest tooth to numb.
Lower second molars are usually, the hardest tooth to numb.
Why is the second molar harder than the first molar?
There's the bone is thicker on the buccal, so it's harder to penetrate. And so that's why I have a whole video that's on troubleshooting lower second molars. And
then don't some of them have a little branch of a nerve up the
There
lingual?
can be mylohyoid. There can be there's also, you could have the perfect injection technique and they don't get numb. You have tetrodotoxin resistant receptors, and some call it redheads or gingers have a hard time getting numb. And sometimes it's just a matter of chemistry and not performance with the needle.
Redheads are hard to get numb, and they also are more likely to have gingivitis.
Gingivitis. Nice one. That's what I came up with, and obviously I found that if you want to get change in dentistry, number one, you've got to go to these ultimate authority figures in dentistry.
So who have you gone to? Who are your ultimate authorities you gone to? You went to the Dean of Midwestern.
Mm-hmm.
And did they just get a new dean? They just had a changing of the deans.
I'm not sure. Dr. Smith is who I talked to.
How long ago was that?
That was in 2015.
Dr. Smith, what was the first name?
Bradford Smith. You probably don't remember this, but in 2015, I went to Greg Stanley. He helped.
Of course I remember that. He's my buddy.
So he taught me how to get out of debt and how to accumulate, and I felt like he was on my side as a new dentist. And I went in and talked to him and his periodontist on staff, and I showed him.
Who's his periodontist on staff?
Well, his consultant. We met on Saturday. He goes, "You got 15 minutes," and 2 hours later, I walked out of there, and he's like, "Come teach my masterminds. These guys they're going to love it." I showed him this graph. Basically, it's the life cycle of a practice: production, collections, and my days worked. And I looked, and as your production collection, raises each year, and then you get debts paid off. You kind of get comfortable, and you start working less, and your production kind of plateaus out. But then all of a sudden, right here, something dramatic happened. I didn't get a new office manager. I didn't raise my fees. I didn't get a new consultant. I didn't get a new machine. All I did was change my needle technique, and I started doing instant numbness. Set down the syringe, pick up the drill dentistry. And my production and collections went off the chart, and my days work went down. I could all of a sudden go in for a hygiene check instead of just doing the exam. I could say, "Hey, let's numb 30, and do that occlusal right there, that buccal, and turn my hygiene room into a treatment room." Back when I started out as an associate, I had one chair, and the other dentist had one chair. Of course, dentists that have 7 chairs can numb and wait, and they don't lose a step. They're always busy. They're always doing something. But when you're down in Dominican Republic and you have one chair and you numb, the way they do third world dentistry, numb, put them in this chair, hold the tray. Numb, put them in this chair, hold the tray. Numb, okay, let's get the first one back. Let's numb. Now let's go to drill. Oh, he still feels it. Oh, numb again. Put him over here. It's a circus. It's a circus of instruments. It's a circus only working on one tooth, not helping the people. I went down Dominican Republic, and I had...
With Greg Stanley?
No.
Greg
I got off track, sorry.
Yeah, Greg was the Haiti. So you went down Dominican Republic with Eric Harris, or?
No, it was a humanitarian trip. And I would numb, drill, fill, done. How'd you do? Good. You want to do another one? And so we could do every single tooth that needed to be worked on and not have to wait and not have to contaminate instruments and trade out. We just go. And so I got this moment at my son's graduation as I hooded him. I was like, I've got to get this to the whole world. Some people, criticize me for charging for the kit or getting out. I've spent the last 2 years literally answering emails from Malta, Macedonia.
Well, who would complain about you charging for the kit?
Well, I mean, or promoting it, I guess.
Yeah.
Yeah.
Well, humans are just bizarre.
Yeah.
I mean, they're bizarre.
So in Malta, Macedonia,
always stay true to yourself.
I get these orders, and they're saying, "Wow, thank you. I can finally do what I need to do. Not running out of anesthetic. They're able to get it numb. They don't have the luxury of referring to a specialist. They don't have nitrous or sedation. They're just one chair and they're going. So this is what needs to happen.
So talk about your kit. How much is the kit, and where do they buy it?
Okay, TuttleNumbNow.com is where you buy it, and the cost is $4.90. I don't charge any tax. Don't charge any shipping. I've shipped them to all 50 states and 16 countries, just off of your Dentaltown. 60%
just off Dentaltown.
60% of the sales have been off of Dentaltown.
60%. You hear that? And you know what's so funny is the craziest thing I see on Facebook is these people, these consultants, these people, and they're always posting to their 400 friends on Facebook. It's like, I'm pretty sure your other 400 friends on Facebook already know what the hell you do. Why are you spending your time posting on Facebook when you could have that same post with 250,000 people on Dentaltown?
Yeah.
I mean, it just blows. I mean, I don't care what they teach, lecture, consult. They're always inbreeding to a couple hundred people on Facebook.
Yeah.
And 60% of your sales are on Dentaltown.
Yeah.
The busiest in-office dental consultant I know of is Sandy Perdue, and she posts every day on Dentaltown.
Yeah.
She said that's where she gets all her leads.
There's so much good advice on there. And, at first I had some people that were, you bend it at the hub, you bend it over, and you bend it back, and it snaps off.
But why does that happen at the hub but not mid-needle?
It's because that's what I discovered. That's what the needle is made.
Just physics?
Yeah. It's just like a pipe bender. If you kink that pipe off at the weld at the bottom, it'll snap off where the glue is. But if you use a pipe bender, and you can bend it and bend it and bend it and bend it and bend it quite a long time. So it's not even about bending needles. That's not the big issue. The big issue for dentists is what the patients are saying. When they can leave, like, what? Don't you have to wait for me to get numb? No. We're going now. We numb now. The slogan, the test is right on it. And then I say, if you feel it, let me know. And then we can go to TNN number 2, TNN number 3, 4, switch out. Patient satisfaction is number 1. Number 2 is tough-to-numb teeth. This is getting people numb that have never been numb before. They come in, they say, I've never been numb. My lips been numb, my tongue's been numb, but it hurts every time. And what that leads to is what I call the chain reaction of failure in dentistry. The number one question to CR that comes in is, why are crowns falling off? But I came up with this chain reaction of failure. It's in my booklet too. And basically, it says the reason crowns are falling off is not the bonding agent that you choose. It's, my theory is, inadequate anesthesia. Because what happens?
For the crown cementation?
Inadequate anesthesia, period, on that lower second molar. It's the hardest tooth to numb. It's the hardest tooth to dry. And why don't we drill more? We're going to leave decay because we start drilling. They jump like, okay, I'm going to finish where it is. We don't have the occlusal reduction that we need. We're not going under the gum enough because maybe that's not numb. And so we have inadequate tooth reduction, inadequate clearance. We leave decay. Cord packing hurts. The impression is inadequate because we didn't get that dry. Bad margins, bad temporaries, pain, and the permanent crown fails. It fractured. Why? It's not because it's a CEREC. It's not because it's bad glue. It's not because it debonded. It's because they never got numb in the first place to reduce the tooth adequately and restore it adequately and dry it properly. So a patient comes in, I'm gonna cement a crown on number 30 on you. I go right back in. I can find pretty much the exact same hole that I made with the needle the first time in. Pressurize the tooth. Low pressure, low volume, overtime technique, penetrate, set it down, air, water, dry it right now, adjust it, cement it, and done.
Now, do you think most people think the biggest, I think the biggest test of anesthetic is actually not a root canal. I think it's an extraction.
Oh, well, there's pulpal anesthesia and then all the surrounding structures, but...
So do you use this for extractions?
Absolutely.
So if you were going to pull that second molar, would it be the same technique as if you were going to numb it for a crown?
Absolutely.
I
treat every single tooth. I start with the one that works best. If intra-osseous works 96 to 98% of the time, why start with an IA block that only works 74% of the time and numbs everything but what you're trying to get numb?
I want to ask you another. This is Dentistry Uncensored. There still is this big taboo about Articaine versus lidocaine. So a lot of people say, well, the only reason Articaine is better than lidocaine is because it's 4% versus 2%. And some people say, I'd rather give 2 carbs of 2% than 1 carb of 4% because there's this paresthesia mythology that's perpetuated. What are your thoughts on Septicaine, which is Articaine in Canada, Septicaine in America?
Mm-hmm.
What are your thoughts of Septicaine versus Articaine, and what are you using in there?
I think you have to go with research on those types of studies. The main, and you can talk to the main gurus, the Stanley Malamets, Al Reeder, these guys that are dedicated their entire lives to this topic. And I think he's made it crystal clear. There's actually a book that I really enjoy that has all the studies comparing. It just came out in 2017 by Al Reeder. It has tons and tons of studies.
Al Reeder.
Al Reeder.
How do you spell Reeder?
I have the book in my car. I can
Really?
go get it. Yeah.
Well, let's see if I can find him on Google.
Nustain, John Nustain, Al Reeder.
Successful Local Anesthesia for Restorative Dentistry by Al Reeder, John Nustain, and Melissa Drum.
It's awesome.
Nice.
Published in 2017. So all this, everything that I'm doing is current, up to date. And if you really want to know about,
so you talked to Al Reeder about
no, I haven't. I've talked to Al Reeder on the phone, and Stanley Malamet, of course. He's been talking. It's interesting that his topics were used to be. There's nothing new in local anesthesia. Magnus invented the needle that goes directly in bone in 1968. Bork injected into cancellous bone. X-tip came about in 1999, but his topic was always there's nothing new in local anesthesia. Then he came out with a lecture that said, is the mandibular block passé? And there was a CD that they put out, and there's a video you can watch on that. And now his current discussion has been the renaissance in local anesthesia. And so he's been in contact with me a little bit, and we're really excited about the future.
Go back, but what percent of the time are you using Septicaine versus lidocaine?
All the time. I don't even have lidocaine in my office. It expires if I have it in there. I don't use it. There's no need.
I want to talk about another subject. We still have deaths in dentistry. Mm-hmm. Most of them are always involve an IV. Mm-hmm. And I've always told these guys that in every hospital in America, you cannot do the cardiovascular bypass surgery and the anesthesia. You can't be an orthopedic surgeon and fix a broken leg and do this. Every hospital mandates a board-certified anesthesiologist. My oral surgeon up the street from me did it 10 years ago. You know what he said? He said that even if it wasn't just because that's really the legal statute, it's faster for him. I mean, we have a hygienist clean the teeth.
Yeah.
He has an anesthesiologist do the anesthesia. He actually makes money off having a board certified anesthesiology. But the other one here locally in Arizona it was a child and
Yeah.
he gave too much lidocaine. He wasn't using Subticaine, he used lidocaine, and he gave so much lidocaine to a 2-year-old it died. The baby died, and it was a tragedy beyond tragedies. But are you using this in pedo? And do you think, the question is, do you use this in pedo, and do you think it means that the child gets less anesthesia? Less lidocaine or Subticaine?
Yes, I use it in children. The toxic threshold for children with Articaine is 1 carpule per 25 pounds. So you can use 2 carpules, but basically I'm using more needles and less carpules. So in my technique, 0.4 cc's is all I'm delivering per needle stick. So I can go around and I can restore teeth in all 4 quadrants with 1 carpule most often.
And when you go into any physician or emergency room in the United States, what's the first thing they do to you? What's the first thing they do when you go to the doctor?
Make you sign papers.
They take your weight,
Yeah, your height, your weight.
your temperature, your height. Do you know anybody who works on children who's not a pediatric dentist who doesn't weigh the children? I mean, you go to any pediatric dentist
That's a
in
good point.
Ahwatukee, first thing they do is like any MD, like any emergency room, stand on the scale, Johnny, take your height and weight. You just said 1 carpule, 25 pounds. These people haven't ever weighed a child.
Yeah.
You have to weigh your child, and you got to pretend that you're a doctor. The doctors use board-certified anesthesiologists, and they weigh their patient before they give them drugs. They take their height, weight, temperature.
That's a good point.
And he just said 1 carpule per 25 pounds. And what do? You just turn to the mom. How much does Johnny weigh? Oh, that works really well in court.
With children, a lot of times since I'm going intra-osseous direct, I'm barely using the stopper width.
Yeah.
Of
And
anesthetic.
another thing, that's a differentiating factor.
And I'm doing this for the dentists in the trenches, the guys that can deliver a lot less anesthetic. They can get teeth numb that have never been numb before, and they can go throughout the world. This is not done until it's in every operatory, in the hand of every dentist, and every patient can benefit from having their tooth numb when they get it worked on.
Now, so right now, I think we covered A to Z. We're at 55 minutes. Do you have any video that you could give me and Ryan to play now, or is that something that's part of the kit?
I have given you the entire kit. You can take it to your office, play with it, and watch and learn, and try it out. Like I said, some dentists use it as a secondary technique on the tough-to-numb tooth, and others realize, wow, the patients really like it, and they use it on every tooth. It'll walk you through the entire protocol. There's a promo video online, but there's a lot of information at the website, TuttleNumbNow.com, comparing PDLs, comparing Stabident, X-Tip, and patient testimonials. I have doctor and patient testimonials, I collected them in 2 weeks.
Okay, so go to TuttleNumbNow.com. And you said you do have a promo video on your website, but did you want to put that on this podcast, or just have them go to the website?
No, they can just go to the website.
Go to the website.
Yeah.
Well, how many children did you have?
I have 5 children.
And one became a dentist, or
One became a dentist.
now is that oldest, youngest, middle?
He's the oldest.
He's the oldest, so
Yeah.
you got 4 more in the batter's box? Or?
No, these are all married and career people, and I have one son on a mission in Thailand, and that's our youngest. So.
Well, I feel sorry for your son in Thailand, because I love Thai food, but you never relax when you eat Thai food because you're always afraid you're going to bite into that one thing that just makes your entire head start sweating. You're like, so you're always eating Thai food, all nervous, like, what is that thing that does that? Do you like Thai food?
I love Thai food.
Even the thing that when you bite, your head starts sweating? You like that too?
Yeah, I like it. I like
Do you?
the hot. I like to
Oh
feel
my
it. I like
God.
to feel the heat.
Thai food is the only food. If you've ever been to, oh my God, Thai food is the only food where if you bite into the wrong thing, there's not enough saltine crackers and water to stop your nose from running for, oh my God. So how's he like Thailand?
He loves it. All those townies that have been very supportive, I want to appreciate and thank you. Guys like Jerome Smith that say, Tuttle, I think you're really onto something. Guys like Coley Dugan, a.k.a. Fart Face. As a closing statement almost, he is one that was kind of critical. Why would I pay this? And then he said, guys, listen. And he has followers. He said, guys, listen. He said, the day I got my loops and my light, I went in my office after working on 3 patients. I shut the door and I sobbed. He said, TuttleNumbNow has had the exact same impact on my practice.
Fartface said that?
Fartface said that.
That when he got his loops and his headlamp?
I got 37 orders from that day that he said that. And then we did a market research on, has people been happy with this, or are they getting it, or mad? I sent out to 400 people. I got 106 responses. For online survey, that's pretty good. Mind you, all they're getting is the kit, and then they have access to me. I personally respond to every email if someone has a question or a complaint. They can send me a video your technique, and I'll say, look, you weren't using the right needle, you weren't on the right location, you weren't, you're not doing anything I taught you how to do. Go back and look at the notes. It'll
But
all
how
come to
cool
me.
is Dentaltown that you get 37 referrals from a doctor named Fartface?
Yeah, exactly.
Is that pretty much sum it all up?
Dentaltown, but Dentaltown, just the support, like they're saying, hey, I saw them going at you on a thread. Want to thank you for what you're doing for dentistry. It's really been rewarding at this stage of my career to have that feedback and that impact on the profession.
Well, I've been a big fan of your posts, and what I want to tell the dentists on the closing thoughts, because we went way past an hour, is when you've done this for 30 years, you eat a lot of crow. I mean, when I got out of school, the smartest cosmetic dentist said that on a beautiful woman, do Dicor crowns and cement it with Duralon. Okay, every one I did broke and had to be replaced for free. Art glass came apart. Horarius Calzer, Targus Vectors, Ivoclar came apart. The guys that were placing implants in the beginning, I can give you names of oral surgeons who had their license taken away because they were doing subperiosteals, ramus frames. They were doing miracles. But the first one that failed, the board looked at and said, what are these yahoos doing? And took their license away. But now, when Dr. Brandmark dies, he makes the cover of the New York Times as this genius. Dude, they weren't a genius when they started. And just because you've been doing something some way 10, 20, 30 years doesn't mean that it's the best, fastest, easiest, highest quality, lowest cost way. And so when somebody comes out with something new, before you start throwing bricks at them, because you just don't know. Just concentrate on your own journey and just try to have a little open mind. And I know you think you're an open mind, but do you think anybody could change your religious views? No. Your political views? No. Your favorite foods to eat, your health, your nutrition? No. So then why do you think you have an open mind in dentistry? And what I admire about the people in dentistry the most, my idols in dentistry are the guys that no matter how many bricks you throw at them, they just build a house out of them.
That's awesome.
And I just think what you're doing is amazing. And I also think it's amazing that on a Saturday, instead of sitting home watching college ball, you're at my house talking to my homies for free about what you've done. And I want to thank you so much for all that you've done for dentistry and Dentaltown. 1,000 posts, and on your day off, come by my house.
Thank you, Howard. It's been a pleasure.